Stop doing this immediately. If you are over 60, doctors are alarmed. I want to start today with something a little different. Instead of telling you what to watch out for in your body, instead of warning signs and symptoms, today I am going to talk to you about things you are doing. Right now, probably today, maybe every single day. Things that feel completely normal, things that feel harmless, things that have been part of your routine for so long that you have never once questioned whether they are safe. Because here is what I have learned in 15 years of practicing medicine and working with adults over 60. The habits that cause the most damage are almost never the obvious ones. Nobody needs a doctor to tell them that smoking is dangerous or that eating fast food every day is bad for their health. People know those things. The habits I am going to talk to you about today are the ones that fly completely under the radar, the ones that feel like nothing, the ones that doctors across America are becoming increasingly alarmed about. Not because any single instance is catastrophic, but because the cumulative daily effect on the aging body is significant, measurable, and in many cases irreversible if not addressed. My name is Dr. Sienna Black. I am an internal medicine physician with over 15 years of clinical experience. And today I am going to walk you through 8 habits, things you may be doing right now, that doctors are genuinely alarmed about in adults over 60. Some of these will surprise you. Some of them may make you a little uncomfortable. Good, because discomfort is often the first step toward change. And change, real, meaningful, sustained change in daily habits, is what protects your health in the decades ahead. Please stay with me for this entire video, and please share it with someone you love who is over 60, because what I am about to share applies to almost everyone. Before I get into the specific habits, I want to give you a framework for understanding why the same behaviors that were relatively harmless at 40 or 50 can become genuinely dangerous after 60. And the answer comes down to one word: reserve. When you are younger, your body has enormous physiological reserve. If you sleep poorly for a few nights, your body recovers. If you are sedentary for a few weeks, your cardiovascular fitness drops but bounces back quickly with resumed activity. If you take ibuprofen regularly for a while, your kidneys manage the stress without lasting damage. If you skip meals, overeat, drink too much coffee, sit for long periods, your young, resilient body absorbs these insults and compensates. After 60, that reserve begins to decline. Your kidney function is lower than it was at 30, so the same medication burden that was manageable then is more stressful now. Your bone density has been declining since your 30s, so the same level of inactivity that maintained bone mass at 40 contributes to osteoporosis at 65. Your cardiovascular system is less adaptable, so the same sleep patterns that were inconvenient at 50 become genuinely harmful at 65. This is not doom and gloom, it is physiology. And understanding it, truly understanding that the margin for error shrinks as we age, is what transforms casual interest in health into genuine daily commitment. So with that framework in mind, let us talk about the habits. The first thing I need you to stop doing immediately is taking ibuprofen and other NSAIDs, non-steroidal anti-inflammatory drugs, as though they are candy. I see this constantly in my practice. Patients over 60 who are taking ibuprofen, naproxen, or similar medications every single day, sometimes multiple times a day, for arthritis pain, back pain, joint stiffness, headaches, and general aches. They buy the large economy bottles at the warehouse store. They keep them on the kitchen counter. They pop 2 or 3 without a second thought because they have been doing it for years and nothing bad has happened yet. Here is what I need you to understand. NSAIDs are not benign medications for adults over 60. They are associated with 3 specific serious risks that become dramatically more significant with age. First, kidney damage. NSAIDs reduce blood flow to the kidneys by inhibiting the prostaglandins that help maintain renal blood flow. In a young person with robust kidney function, this effect is transient and manageable. In a person over 60 whose kidney function has already naturally declined and who may have additional kidney stress from blood pressure, diabetes, or dehydration, Regular NSAID use can cause measurable, progressive, and permanent kidney damage. Second, gastrointestinal bleeding. NSAIDs damage the protective lining of the stomach and intestines. The risk of serious GI bleeding from NSAID use increases with age, and bleeding that a younger person's body can manage becomes life-threatening more quickly in an older adult. Third, cardiovascular risk. Regular NSAID use, particularly at higher doses, is associated with increased risk of heart attack and stroke, a risk that compounds with age and existing cardiovascular disease. I am not telling you to suffer through pain without help. I am telling you to have a conversation with your doctor about safer pain management options, acetaminophen used appropriately, topical anti-inflammatory gels, physical therapy, certain supplements with evidence behind them that do not carry these serious risks for adults over 60. The second habit I need you to stop is sitting for more than 2 hours at a stretch without getting up and moving. And I want to be very specific here because people often confuse this with the message about overall exercise, which is also important but is a different issue. You can exercise for 30 minutes every morning and still cause significant harm to your cardiovascular and metabolic system if you then sit motionless for 6, 8, or 10 hours. Research in the past decade has established that prolonged uninterrupted sitting is independently harmful, meaning that its harms are not eliminated by exercising at other times of day. Prolonged sitting reduces blood flow through the large veins of the legs, increasing the risk of blood clots. It slows metabolic rate dramatically, reducing glucose and fat metabolism in ways that compound insulin resistance. It reduces the muscular contractions that normally help return blood to the heart, increasing cardiovascular strain. It promotes inflammation through mechanisms that are still being fully elucidated but that are consistently observed in population studies. And after 60, when circulation is already somewhat less efficient, when blood clot risk is already higher, when metabolic flexibility is already reduced, the impact of prolonged sitting is amplified significantly. The solution is simple and costs nothing. Set a timer for every 90 minutes to 2 hours while you are sitting. When it goes off, stand up. Walk to the kitchen and back. Do 10 slow squats if you are able. Walk to the mailbox. Stand and march in place for 2 minutes. The specific activity matters far less than the interruption of the prolonged sitting. Breaking up sedentary time with even brief movement every 90 minutes has been shown to measurably improve blood sugar control, reduce cardiovascular risk markers, and improve vascular function in older adults. This is one of the simplest and most impactful changes you can make today. The third habit is one that I know will surprise many of you because it is something that is almost universally recommended. And yet the way most people over 60 are doing it is actually causing harm. I am talking about drinking water, or more specifically, not drinking enough of it. Chronic mild dehydration is one of the most common and most under-recognized health problems in adults over 60. And here is why it develops so insidiously. As we age, the sensation of thirst becomes less sensitive and less reliable. Young people feel thirsty when they are becoming dehydrated, and that thirst drives them to drink. Older adults frequently do not feel thirsty even when they are significantly dehydrated. The thirst mechanism simply does not fire as reliably. The result is that many adults over 60 are chronically operating in a state of mild dehydration that they are completely unaware of, and the consequences are significant. Chronic mild dehydration concentrates the urine and increases the risk of kidney stones and urinary tract infections. It reduces kidney blood flow and contributes to declining kidney function over time. It thickens the blood slightly, increasing the risk of blood clots and making the heart work harder to pump. It impairs cognitive function. Studies show that even mild dehydration measurably reduces concentration, memory, and processing speed. It causes constipation. It worsens joint pain by reducing the fluid content of cartilage, and it contributes to falls. Because dehydration reduces blood pressure and blood pressure drops when standing, causing the dizziness that leads to falls in older adults, the recommendation is straightforward. Drink a minimum of 6 to 8 glasses of water per day. And do not wait until you feel thirsty because that signal is no longer reliable after 60. Drink on a schedule, a glass when you wake up, a glass with every meal, a glass mid-morning and mid-afternoon. Keep a water bottle visible and within reach at all times. This single habit change can have remarkable effects on energy, kidney health, cognitive clarity, and overall well-being. The fourth habit is skipping breakfast, or more accurately, going long periods in the morning without eating, which creates blood sugar volatility that is particularly harmful after 60. I know that intermittent fasting has become enormously popular and that many people are extending their overnight fast well into the morning hours deliberately. And for certain younger, metabolically flexible individuals, some forms of intermittent fasting have genuine benefits. But for adults over 60, particularly those with prediabetes, diabetes, cardiovascular disease, or a history of falls, prolonged morning fasting creates specific risks. When you fast for extended periods, your blood sugar drops. Your body releases stress hormones, cortisol, and adrenaline to raise blood sugar back up by breaking down muscle and liver glycogen. Those stress hormones raise blood pressure, increase heart rate, and create cardiovascular strain. In an aging body with less metabolic reserve, this stress response is more pronounced and more damaging than it would be at 30. Low blood sugar also reduces cognitive function and reaction time, increasing the risk of falls, accidents, and medication errors. And extended fasting in older adults is associated with muscle wasting, sarcopenia, which is already one of the most significant health threats facing people over 60. Loss of muscle mass increases fall risk, reduces metabolic rate, worsens insulin resistance, and reduces overall functional capacity in ways that compound dramatically over years. This does not mean you need to eat a large, elaborate breakfast the moment you wake up. It means that within 1 to 2 hours of waking, you should consume something that includes protein and is moderate in refined carbohydrates, eggs, Greek yogurt, oatmeal with nuts, or similar, to stabilize blood sugar, preserve muscle, and give your brain and body the fuel they need to function well through the morning. The fifth habit is taking multiple supplements without medical supervision. And I want to approach this carefully because I know how many of my patients rely on supplements and feel strongly about them. I am not anti-supplement. There are specific supplements with genuine evidence behind them for specific conditions in specific populations. But the supplement industry in America is a $50 billion industry that operates with far less regulatory oversight than the pharmaceutical industry. And many of the supplements being taken by adults over 60 are not just ineffective, but actively harmful in the context of aging physiology and medication use. High-dose vitamin D without monitoring can cause toxicity, elevated blood calcium, kidney stones, and cardiac arrhythmias. High-dose vitamin E has been associated with increased all-cause mortality in older adults in several large studies. High-dose niacin, marketed for cholesterol, can cause liver damage and dangerous blood sugar spikes. Fish oil at high doses can interfere with blood clotting, a serious concern for anyone on blood thinners or aspirin therapy. Many herbal supplements, including St. John's wort, ginkgo, garlic supplements, and ginseng, interact with commonly prescribed medications in ways that can reduce their effectiveness or increase their toxicity. And perhaps most importantly, many people over 60 are taking so many supplements that they have lost track of everything they are consuming, creating unpredictable interactions that neither they nor their doctor can fully account for. Please bring every supplement you take, every bottle, every powder, every gummy vitamin, to your next doctor's appointment. Have a real conversation about which ones have evidence for your specific situation, which ones may be causing harm, and which ones can be safely eliminated. Your supplement routine should be as carefully considered as your medication list, because in your body, there is no meaningful difference. The sixth habit is ignoring dental health. And I include this because the connection between oral health and systemic disease in adults over 60 is one of the most underappreciated and underutilized areas of preventive medicine. The bacteria that cause gum disease, periodontal disease, do not stay in your mouth. They enter your bloodstream through inflamed gum tissue and travel to distant sites in your body. There is now strong evidence linking periodontal disease to increased risk of heart attack and stroke. The same bacteria found in infected gum tissue have been identified in arterial plaques. There is a well-established bidirectional relationship between periodontal disease and diabetes. Gum disease makes blood sugar harder to control, and high blood sugar makes gum disease progress more rapidly. Periodontal disease is associated with increased risk of respiratory infections, including pneumonia, because bacteria from the mouth can be aspirated into the lungs. And poor dental health is associated with cognitive decline and dementia in several large epidemiological studies, though the exact mechanism is still being investigated. After 60, dental care becomes even more important, not less, as dry mouth from medications, reduced saliva production with aging, and the cumulative effects of decades of dental wear create increased vulnerability to tooth decay and gum disease. Brush twice daily, floss daily, or use a water flosser if traditional flossing is difficult. See a dentist for a cleaning and examination at least twice a year. And tell your dentist about all your medical conditions and medications, because they need that information to give you appropriate care. The seventh habit is dismissing sleep problems as an inevitable part of aging. Poor sleep, whether from insomnia, sleep apnea, restless legs, or other causes, is not a normal or acceptable consequence of getting older. It is a medical problem with real, measurable, serious health consequences that compound with every year it goes unaddressed. Chronic poor sleep raises blood pressure. Studies show that even 1 week of inadequate sleep causes measurable increases in blood pressure that persist into the following days. It impairs glucose metabolism and worsens insulin resistance, contributing to prediabetes and diabetes. It reduces immune function, increasing susceptibility to infections and reducing the effectiveness of vaccines. It accelerates cognitive decline. The brain uses sleep to clear the metabolic waste products, including amyloid beta, that are associated with Alzheimer's disease. It increases the risk of depression and anxiety. It promotes inflammation throughout the body, and it dramatically increases fall risk because sleep deprivation impairs balance, reaction time, and coordination in ways that are particularly dangerous for older adults. If you are sleeping fewer than 7 hours per night, if you wake frequently and cannot return to sleep, if you snore heavily or wake gasping, if you feel unrefreshed after a full night of sleep, please discuss this specifically with your doctor. Sleep apnea alone, which affects a very large proportion of adults over 60 and is dramatically underdiagnosed, when treated with CPAP therapy, produces improvements in blood pressure, blood sugar, cognitive function, and quality of life that no medication can fully replicate. The eighth habit, and this is the one I feel most passionately about because I see its consequences every single week in my practice, is avoiding or delaying medical care because you do not want to be a burden, because you are afraid of what you might find out, because you feel fine and therefore assume you are fine, or because navigating the healthcare system feels overwhelming and exhausting. I understand every one of those reasons. Genuinely, healthcare in America is expensive, complicated, and often emotionally draining to navigate. The fear of a serious diagnosis is real and powerful. The desire not to worry family members is deeply human, but here's the truth that I need you to hear. The conditions that kill adults over 60, heart disease, cancer, diabetes, kidney disease, liver disease, are almost universally more treatable when caught early than when caught late. The difference between a stage 1 cancer diagnosis and a stage 4 cancer diagnosis is often measured in years of life. The difference between kidney disease caught at a GFR of 65 and kidney disease caught at a GFR of 20 is the difference between manageable and devastating. The difference between a heart attack caught through a routine stress test and one that hits without warning in the middle of the night is sometimes the difference between being here and not being here. Regular preventive care, annual physicals, appropriate cancer screenings, blood work that monitors kidney function, blood sugar, cholesterol, and thyroid is not optional maintenance for the chronically ill. It is the single most powerful tool that modern medicine has for protecting the health of adults over 60. Please use it. You are not a burden for using it. You are being responsible. You are taking care of yourself. And the people who love you are counting on you to do exactly that. I am Dr. Sienna Black. Thank you for watching Healthy After 60. Please share this video with someone you care about who is over 60. Hit the like button if this opened your eyes today. Subscribe for new health videos every week, and I will see you in the next one. Take care of yourself. You have earned it. Before I truly close today, I want to come back to something I said at the very beginning of this video. The idea of reserve. The idea that after 60, the margin for error in our daily habits becomes smaller. Because I want to make sure you leave this video not with a sense of fear or restriction, but with a sense of genuine empowerment. Because here is what 15 years of clinical medicine has taught me about the human body after 60. It is remarkably responsive, remarkably adaptive, remarkably capable of improvement when given the right conditions. The research on lifestyle change in adults over 60 is genuinely inspiring if you take the time to look at it. Adults in their 60s and 70s who begin regular walking programs show measurable improvements in cardiovascular function within weeks. Adults who increase their water intake show improvements in kidney function markers within months. Adults who address sleep apnea with CPAP therapy show improvements in blood pressure, cognitive function, and blood sugar control that rival the effects of adding new medications. Adults who stop daily NSAID use allow their kidneys to partially recover function that was being suppressed by the medication's effects on renal blood flow. Adults who break up prolonged sitting with regular movement show improvements in insulin sensitivity and vascular function in as little as 2 weeks. The body wants to be well. It is working toward health constantly, filtering, repairing, adapting, compensating. What it needs from you is not perfection. It needs you to stop placing unnecessary obstacles in its path. The 8 habits I described today, the routine NSAID use, the prolonged sitting, the inadequate hydration, the prolonged morning fasting, the unsupervised supplement stacking, the neglected dental care, the dismissed sleep problems, and the avoided medical care. These are obstacles, not inevitable ones, not permanent ones, ones that can be addressed, reduced, and in many cases eliminated with knowledge, intention, and support. And the payoff for addressing them is not abstract or distant. It is felt in the quality of your daily life, in your energy, your clarity, your mobility, your sleep, your freedom from pain, your confidence in your own body. That is what I want for every person watching this channel. Not just more years, better years. Years where your body is working with you rather than struggling against the habits that are silently wearing it down. I am Dr. Sienna Black. Take good care of yourself. I will see you in the next video. I also want to take a moment to speak directly to those of you who recognized yourself in more than 1 or 2 of the habits I described today. Because I know that for some people watching this video, the reaction will be, that is me. I do that. I do several of those things. And I want to acknowledge that recognition honestly, rather than simply sending you off with a to-do list. Change is hard, especially change to habits that are deeply embedded in daily routines that have developed over decades. Especially change that requires navigating a healthcare system that can feel overwhelming. Especially change that requires acknowledging that what you have been doing may have been causing harm, which involves a kind of grief for the time that has passed and the damage that may have accumulated. I see this in my patients, and I want to tell you what I tell them. You do not have to change everything at once. You do not have to be perfect tomorrow. You do not have to feel guilty about what you did not know before today. What matters, the only thing that matters going forward, is what you choose to do with what you know now. Pick one habit from this video, just one, the one that resonated most, the one that you recognized most clearly in your own life, and make one concrete change to that habit this week. Just this week. See how it feels, notice what changes, let that small victory be the foundation for the next one. Because sustainable change in health behaviors, the kind that actually sticks and produces lasting results, almost never comes from wholesale overnight transformation. It comes from the accumulation of small, consistent changes made with genuine understanding of why they matter. You have that understanding now. Use it at whatever pace feels sustainable for you. Your body will respond. It always does. I am Dr. Sienna Black. Thank you for being here. I will see you next time. There is one more thing I want to address before I sign off completely today, and that is the question of how to talk to your doctor about the things you learned in this video. Because I know that many of my patients, particularly those who grew up in a generation where doctors were authority figures you did not question, struggle with bringing up concerns, admitting to habits they think their doctor will disapprove of, or asking for specific tests or referrals. So let me give you some practical language. When it comes to NSAID use, tell your doctor exactly how often you are taking them and ask specifically what alternatives are safe for your kidneys and your cardiovascular system given your individual medical situation. When it comes to sleep problems, do not just say you have trouble sleeping. Describe specifically what happens, how long it takes to fall asleep, how often you wake, whether your partner has ever mentioned that you snore or stop breathing, whether you feel rested in the morning. Ask specifically whether a sleep study is appropriate. When it comes to supplements, bring every bottle, lay them out, ask which ones have evidence for your specific conditions and which ones may interact with your medications. When it comes to dental care, tell your dentist about your blood pressure, your diabetes or prediabetes, your heart disease if you have it, because this information changes how they care for you. And when it comes to preventive screenings, ask your doctor directly what screenings are recommended for someone your age and sex, whether you are current on all of them, and when you should next have your comprehensive blood work including kidney function, blood sugar, cholesterol, and thyroid. Be specific. Be direct. Write your questions down before your appointment so you do not forget them in the moment. You are the most important advocate for your own health, and an informed, prepared patient gets better care. Every time. I am Dr. Sienna Black. Take good care. I will see you in the next video.